Welcome to Once Upon a Case, because the law isn't just for lawyers, it's for everyone. Okay, let's dive into one of the strangest and most important cases in tort law, Mohr v. Williams. If you're a law student or just love courtroom drama, this one's got twists, ethics, and a surprise surgery. So buckle up. Picture this. It's Minnesota, 1905. Mrs. Mohr walks into Dr. Williams' office complaining about her right ear. After some checks, Dr. Williams recommends surgery and Mrs. Mohr agrees, but only for her right ear. Everything's clear, consent is given, case closed, right? Well, not exactly. Fast forward to the operating room. Dr. Williams starts working on Mrs. Mohr's right ear like they planned, but during surgery, he discovers her left ear is actually worse off. So, without waking her up or getting her permission, he switches gears and operates on the left ear instead. When Mrs. Mohr finds out, she's not happy. She sues Dr. Williams for battery. And here's where the legal fireworks begin. Now, at first you might think, hey, the doctor was just trying to help, right? He meant well, but Mrs. Mohr didn't consent to surgery on her left ear. That's the crux of this whole thing. The court had to answer, can a doctor perform a different procedure than the one agreed to just because it seems like the right thing to do in the moment? The answer? Nope. The Minnesota Supreme Court ruled in Mrs. Mohr's favor. Why? Because consent isn't a technicality, it's a fundamental right. Even if the doctor's intentions were good, even if the surgery actually helped doing it without the patient's permission, made it a battery in the eyes of the law. That's huge. It means that even doctors, especially doctors, have to respect the boundaries set by their patients. Now, obviously there are exceptions. If it's a life or death emergency and the patient can't give consent, that's a different story. But in Mohr's case, her left ear wasn't an emergency. There was time to wait, to ask, to get consent. This case reshaped medical law. It set the standard that every law student learns today: consent isn't optional, it's everything. Patients get to decide what happens to their bodies. And if you cross that line, even with good intentions, you're on the hook. So next time you're studying torts or prepping for finals, remember Mohr v. Williams. It's not just about ears and doctors, it's about autonomy, respect, and the power of saying yes or no. If you want more legal stories that shape the world, hit subscribe, and let's keep exploring the cases that changed everything. See you next time.